So, Dr. Nita, set us straight here. For people who don't know, tell us all about PCOS.
Well, women usually have a small amount of male sex hormones called androgens, but with polycystic ovarian syndrome, which is also known as polycystic ovary syndrome or PCOS, the ovaries produce an excessive amount of those androgens. So these women end up with a hormonal imbalance. And, this is common. In fact, it's thought to be the most common endocrine reproductive disorder in women, impacting about 5 to 10% of premenopausal women.
Wow. Dr. Nita, what should women look out for? Like, what are the common signs of PCOS?
Signs and symptoms of PCOS can vary a lot. In some instances, they're very mild, like people don't even know they have PCOS. And in some instances, it can be severe. But some of the common symptoms include, as Sam mentioned, excessive hair growth, which is known as hirsutism. And that can impact up to about 70% of women with PCOS. And there can be varying degrees of that. Also, irregular periods, oily skin, or acne. And another big one, Dr. Sportelli, is going to be a problem losing weight. Up to about 80% of women with PCOS will be overweight or obese. But I also want to say, if you have any of those things, don't just self-diagnose. Don't assume that you have PCOS, because there can be lots of reasons for irregular periods, oily skin, or even excessive hair growth. So you want to go to your doctor, and there are different ways that PCOS can be diagnosed. But one of the most common ways includes the usage of a system that has these 3 basic criteria. And if you have 2 of these 3, then you're diagnosed with PCOS. And those include excessive androgen levels, so high levels of those male sex hormones, irregular ovulation, or polycystic ovaries on ultrasound.
And Dr. Nita, would you say that PCOS is on the rise?
I think that we're being more mindful of it, and we're having important conversations like this one. So when people are having issues, they're talking to their doctor, but it definitely is very common. So when you think about 5 to 10% of women being impacted, that's a significant number of women.
For women who are experiencing really severe hirsutism, is there anything they can do, Dr. Nita?
Yes. In some instances, weight loss can be beneficial, but also estrogen and progesterone containing birth control pills. Sometimes we'll use a medication to block the effects of androgen on the skin. And there's a cream that you can use, eflornithine hydrochloride, and it can inhibit hair growth, but you have to use that indefinitely or the hair growth will resume. And then there are conventional ways to remove hair, such as waxing, shaving, creams, lotions, electrolysis, or laser hair removal.
Samantha, did you try any or all of these methods?
I've tried quite a bit. The only one that I didn't get to actually try is because it was so expensive was laser hair removal. They said just for a couple sessions of my chin, it would be $500 a pop.